Today, we're going to discuss how to demystify holistic medicine providers. My name is Dr. Erica Steele. I'm a holistic doctor in family practice. My hair's crazy. So just totally ignore it. It's just kind of a messy look. So today we're going to discuss holistic medicine providers because there's a lot of confusion around holistic medicine and holistic doctors and who we are and what we do. So this video is really dedicated to that. And if you're interested in learning more in depth, scope of practice, et cetera, we have a free webinar to really demystify and go over all the holistic medicine providers, their scope of practice, what they're trained in, what they're not trained in, how we use them, et cetera. So go ahead and check the link below to look for that. All right, so now let's talk about what holistic medicine is. So there's a lot of confusion around what actually holistic medicine truly is. So we throw words around like body, mind, and spirit, but what does all of that mean? So holistic provider is trained in the body, right? How the body functions, basic nutrition, things like that. But they're also trained in mind-body medicine. So they're trained in either mental, like psychology, or they're trained in some emotional modalities like EFT. So they have to have some additional training, right? So when we're looking at or treating a person holistically, it means that we're looking at the patient from multiple different angles. So we know in conventional medicine, they tend to like subdivide the body. So you'll go to a primary care and then let that primary care will send you to a specialist. Like they'll send you to a cardiologist or they'll send you to a neurologist, that sort of thing. So when we are working in holistic medicine, we see all of the person. So we see the relationship that, let's say, this organ system has with another, right? And we're able to articulate that. But we're also able to see the mental, emotional, psychosocial, spiritual aspects of a person's illness. So a person can have what we call a dis-ease, right? So dis meaning kind of out of balance, and then ease meaning that there's some level of suffering there. And that level of suffering can be anywhere. It can be spiritual, it could be mental, it could be ancestral, it could be emotional, it could be environmental, it could be a lot of different things. And a lot of times it's not just one, it's a multitude of different areas that a person is working on. So let's jump into some of the common holistic providers that you may think are more holistic, and maybe they are, maybe they're not. I'll leave it up for you to decide. All right, so make sure that you like, share, and subscribe if you're enjoying my content and you want to learn more about holistic medicine. So I still can't get over my hair. It's like all crazy. Okay, so nonetheless, all right, so let's get into, let's say chiropractors, right? So a lot of times people look at chiropractors as holistic doctors. And while they look at the whole body and the whole person, their scope of practice really is nothing more than freeing up the subluxations, that is the partial dislocations in the spine. So their philosophy is if everything runs to the spine. It is the nerve, brain, spine connection. And so they're looking to impede on that. Sometimes nutritional factors can contribute that. So they will sometimes do nutrition work or sometimes offer supplementation. But that does not in and of itself make them a holistic doctor. If they're not working with you on your mental, emotional blocks, if they're not giving you tools to address those, if they're just dealing with you on a physical plane, like a physical body, your physical body, that is not necessarily holistic, but it is more of a naturally trending provider. Another common provider that people look at as holistic is an acupuncturist. Now, acupuncturists, I would say, are definitely more in the holistic vein, mostly because they're working on the bioenergetic frequency of the body, the meridian system. That's where they're, going in. That's a whole different system than our Western medicine system. So they use an Eastern medical system that uses the meridian system. The meridians is where your flow of chi or your flow of energy. And it is believed that when we use things like acupressure points, acupressure needles, it frees the chi and allows that energy to work through your various organs like your liver, your lungs, your large intestines, etc. I myself have found some significant value in acupuncture, especially to help my nervous system, help my mental, emotional state, and just help my body in general. So I really enjoy them from that perspective. Like they really do address more of the energetic components of the body. But again, there's not a lot of psychology happening. There's not a lot of communication. There's not a lot of skill building per se, but it definitely works passively and can help you move some things. Another natural healthcare provider or holistic provider that often people go to is a health coach. And while I really value health coaches, a health coach's scope of practice is really just more so to support holistic doctors. So they're going to work with the patient on their lifestyle goals, maybe some behavioral, some habits, really work with them step by step on helping them to provider I want to get into is a health coach. So health coaches, they really act as a support to a holistic doctor. They're going to work with patients on their lifestyle, their habits, their behavior, maybe help them with their food, but they don't really work, let's say, again, on the psychology, the mental, emotional, psychosocial, spiritual aspects of it, because they don't have that training. Also, too, they don't have the training in biochemistry or laboratory diagnostics, nor do they have the scope of practice to recommend supplements. I know a lot of times health coaches do work outside of their scope of practice. And if they have another certification, like let's say if they are an RD or something like that, they have that additional training that allows them to understand that piece. But just to understand, health coach's scope of practice doesn't really have a holistic stand. It's really more lifestyle, diet, and behavioral patterns. Another holistic provider, again, in that same vein, is a life coach. So life coaches, again, really serve a purpose. They do a lot of habits, skill building, but again, very limited in training and understanding in terms of deep neuroscience or deep human behavior, or, how a person is going to, work through a stage of change. And I often find a lot of times life coaches lack structure, and that can be really challenging, especially for people who have experienced trauma. So those are just some of the holistic providers. Naturally, there are so many, and it's important to really look at these from a critical lens, not because we're trying to judge or shame or ostracize, but really more so because we really want to define what holistic medicine is, because holistic medicine is a very unique practice. I believe that our Afro-Indigenous ancestry really helps us in the delivery of holistic medicine. I believe that was our birthright. It is really our roots. We were, cultivated growing up, in very matriarchal societies, growing up using fresh herbs, working with the medicine women, doing ceremony, all of these various things. And unfortunately, through post-colonization, we have gotten so far away, far removed from our original spiritual as well as healing practices. It is not a wonder that Black people all around the globe are struggling and suffering in the current healthcare systems, just because they really weren't built to accommodate our holistic practices that we so desperately need in our healing. So hopefully this video has been helpful in helping you determine, who's who in terms of the holistic medicine providers. Again, if you want to look deeper at this particular topic, I do have a free webinar. Just go ahead and click the link below and learn away. So like, share, and subscribe if you enjoy my content.